I'd like to say hello to my patients and people out there in the Turkish community. First of all, it's very important that people get the diagnosis right. And that's the most important thing, is to come here and to get answers to your questions as to what is the underlying cause of your back problem. Once we have established that, then we can establish the correct treatment that's required to put that problem right, get the patient out of pain. But more importantly, it's not about just fixing the pain, it's about fixing the problem, the underlying cause of the problem of the pain, rather than just treating the symptoms themselves. Because if we were just to treat the symptoms, that may ease it temporarily, but then the problem is going to come back very quickly. And that's why it's important. The first thing is to obviously get rid of the pain, then to correct the problem, and then the third thing, which is the most important thing, is long-term, about keeping the problem from coming back. And that's about prevention or maintenance treatment. And it's all three elements which are equally as important with that. In terms of what causes most problems with the back and with the neck, regardless of whether or not there's problems with leg pain or ushma, or pain down the leg or down the arms as well, same ushma in the hands and the fingers, most of the problems can be traced back to the spine. In terms of the vertebra, these are the bones, the chemic that makes up the spine. Each bone moves separately, one segment relative to the others, and because of the pressure on the back and neck. Now, quite often, a lot of my patients, particularly in the Turkish community, work in off licenses, local shops, convenience stores, supermarkets, cash and carries, and in the restaurant, in kebab shops and restaurants. And most of these jobs involve long time of standing, not moving very much and being on their feet for long periods of time, bending and lifting as well too, lifting heavy objects, and constantly physically being very difficult. Equally so, a lot of the women in the Turkish community, most of them will be cooking and cleaning and looking after the household. And again, this involves a lot of bending and lifting. And the pressure and strain they're putting on their back and their spines will cause the spine to compensate and sometimes slip out of alignment. If the spine starts to come out of position, it can irritate and pinch on the nerves. Any pressure or impingement on the nerves causes pain, muscle spasm, inflammation, which creates the pain. So it's about correcting these problems through manipulating the spine carefully back into a straight position, removing any pressure or irritation to the nerves, and realigning the spine. Because the nerves, irritation to the nerves travel from the neck down the arms and from the back and down the legs. So the pain in the ushma that comes down the back and legs is usually traced back to the spine. So we correct these problems, which initially will get rid of the symptoms and ease the symptoms in terms of their pain and their sensations. But more importantly, it's beyond that, because we have to correct the problems and fix the underlying cause of the symptoms thoroughly, which can take a few weeks. It's not something that will happen in just 1 or 2 treatments. But once we've corrected the problems, then we have to maintain that, because they're still doing the same jobs. They're still doing the same things at home. They're still having the same requirements and responsibilities. But as long as they're coming and having some treatment every so often, these problems will now be prevented for the future. So in theory, they may go the rest of their life without having these pains if they followed my advice. I have to say we have very, very strong following in the Turkish community, and obviously outside the Turkish community as well, that we've built up a reputation. We've been established here for nearly 30 years, a long time. We work very closely with a lot of specialists, pain specialists. We refer to for MRI scans, and because we're established and we have such a great reputation, within a very short period of time, within a few weeks, we're seeing more patients. We're just as busy, if not busier, than we were before COVID started. Oh yeah. Yeah, as I said, if you have any questions, all you have to do is just ring up. We can make an appointment and book an appointment, whenever's convenient. We're here 6 days a week. We're here in the evenings as well. And all you need to do is to come in, make the appointment, and we'll be able to help you and assess the problem and hopefully be able to get you out of pain, but more importantly, fix the problem that's causing the pains. And that's most important, is fixing the underlying cause rather than just the symptoms. So you'll have no more pain, but more importantly, no more problems.
certainly. Actually, my sister developed a back pain which lasted for a few years, and then, you know, she started to not respond to treatment. So her doctor actually referred her to Dr. Kevin, and that's he think that she might be helped by his practice. So we came, and she started the treatment, and she almost have 9-10 sessions so far, and she felt really much better. And you know, she's very happy with the treatment that she's getting here in the center. The staff were very lovely, and it's a very comfortable place to be in, really. The problem was a back pain, and she have really a very bad back pain that prevent her from sleeping, and sometimes she awake in the middle of the night with a severe pain and things. But since she came, and with his treatment and advices, things is getting really much better. So she's hoping that this would sort out completely her problem, as Dr. Kevin said. He said it's still she need a little bit of more sessions to do, but he is sort of convinced that he can sort her problem out without any further problem or medications needed. So that's what we are hoping.